Thanks for staying with us. It's still VSA. Now, some weeks ago, we discussed the prevalence of child mortality in this part of the world, which can be attributed to a number of things, and it includes the lack of access to good care, environmental hazards, and even poverty. Now, a non-governmental organization, HerBabyBox, has taken it upon itself to do all it can to make sure these infants are well taken care of to the best of their ability by providing gift boxes to the new mothers and also doing some follow-up as well. Now, their mission is to provide low-income pregnant mothers in Africa with the resources and the knowledge that they need to give their babies the best possible start in life, according to them. Now, in these boxes, one will find treasure trove of essential items to care for newborns from birth to 6 months, from soft blankets to baby clothes to diapers to hygiene products and feeding essentials to toys as well. Each box is carefully curated to ensure that mothers have all the basics that they need to care for their little ones with love and confidence. And again, this is exactly according to the organization. Now, joining us to have this conversation is Victor Obisike Amadi, the co-founder of HerBabyBox Africa. Thank you so much, Victor, for joining us on the show.
Thank you very much for having me.
Now, I must commend HerBabyBox. I've seen some of the things that you have done, and it's really amazing. Kudos to you and your team. Well done. Now, I think I'm going to start off by asking, how did the idea for HerBabyBox come about?
It was born out of the need to provide solution. JFK said, ask not what your country can do for you, but what you can do for your country, right? So for us, in as much as it is personal, like growing up, I had some issues while growing up. My mom lost her two kids, 2 girls. So I know what it is, you know, coming through for these mothers. Do you understand? And also, I'll give you statistics. In Finland, right now, I think as of 2022, Finland, they have at least just 2 deaths per 1,000 live births, as compared to Africa, where you have like 41.6 deaths per 1,000 live births to get. And if you narrow that down to Nigeria, I think Nigeria has 55.17 deaths per 1,000 live births. That is to say, one in every 18 children die in Nigeria, like do not make it past their first year. So we had that nudge to come in also to help these mothers, you know, give them these items, like bridge the gap, give them this box to help reduce the rate of infant mortality.
Right. Now, speaking of the box that are being given, what are some of the essential items that the NGO provides to these new nursing mothers?
So we have the diapers, we have the box. First off, let me just say that the box itself, one of the most important features of the box is it serves as a bed, a safe sleeping cot for the baby.
Oh,
we discovered, yes, when you take out all the items in the box, the foam inside there is made with Macintosh. Even if a child pees, you just need to clean it.
Wow,
so
that's
impressive. That's one of the most important features of that box. So the items there, where you have the wipes, diapers, feeding bottle, the tita, everything, basic items that a child, personal kit, personal bath, wash, soap, everything that a child would need, even as much as giving the mother the breast pad, you know, to help. Yes, so that's what the box contains.
So in packing these boxes, are these items tailored to the specific needs of the individual mothers? Like, do you see the mothers and decide, okay, this is what she would need to start, or are they like standard packages for each mother?
So they are standard packages, I believe. Even we tailored the box down to the Nigerian, how we live here. So inside that box, we also have the mosquito net. Because most times, yes, so that it helps also protect the babies. When you put the baby in a box, you just use the net to cover. So it's like general things that a mother would need. You know, I believe what mother A will need, mother B will need, the diaper, the baby bath wash and everything. So on the part where if they require special attention, that's where we now go into the other side that we do, which is the maternal education.
Right.
Yeah.
Right. And over time, as long as you have been doing this, how would you say that receiving the Her Baby Box has helped new nursing mothers to feel supported and cared for?
Wow, trust me, most of them, they feel really, really happy. You hear stories like, I never expected this. I didn't even know where I'm going to get anything from, and you guys came through. So it also helps them. It makes them really, really happy. It makes them want to go on. Some of them have given up. They don't even know where to get anything at all. So it gives them that hope that there is hope, and they believe that they can make it through. So.
So, in choosing the areas you visit or the mothers that you gift these boxes, are there any specific criteria or qualifications for the new mothers to be, let's say, eligible to receive these boxes? Or how do you select the beneficiaries?
We work with the social welfare of most hospitals that we visit. So they are the ones that will tell us, sometimes when mothers come in or when expectant mothers come in, they know the ones that cannot afford these things.
Right.
So we work hand in hand with them. They enable us to select and pick those ones that the target is low-income pregnant mothers in Africa, to help them to bridge that gap, giving every child an equal start. Yeah.
And over time, what would you say are some of the challenges that you have faced as an organization?
I'd say funding. I'd also say acceptability. Most hospitals that will go to, they require us. We know that these mothers need these things. They will require us to do a lot, feel this, feel that. We'll go through all the processes. They will still, there are hindrances here and there. So those are the challenges that we face, because for the workforce, we've been growing since we started. We've had over 100 volunteers. We've grown. Our social media presence has also grown. So just on that part where we need more hands, we need people to partner with us and be able to help reduce the high rate of infant mortality.
So speaking of infant mortality, how would you say that this initiative has helped reduce it?
Okay, so if statistically, I think in Africa, some 10 years ago, it was at 81.6 deaths per 1,000 live births. Now it's at 46. So organizations like mine and other organizations have come in and they've also helped to reduce it. As specifically, like the hospitals that we visit, especially mother and child care, AJA, the rate has reduced drastically, because we have a follow-up. We talk to the hospitals and there has been growth, tremendous improvement on the rate.
And how do you think that the government can help to further reduce the infant mortality?
In a lot of ways, because there's that saying in Finland, I think it's the government that started it. They saw the need to come in for mothers that just put to bed. If they say that the children are the future of tomorrow, if we don't keep them alive or if we don't protect them now, how then do we make a better or build a better future? We don't even know. Maybe we've lost most presidents or senators. So I believe that the government can look into it, help organizations like mine, also bring aids or set up policies that would help hospitals identify these mothers that need these essential items and provide it for them. Sometimes it's not just the items that will provide for the kids. The joy it gives to the mother, knowing fully well that my child is taken care of, it goes a long way.
Right. And aside some of these basic necessities that the nursing mother needs to take care of the children, would you say that there are other factors that contribute to infant mortality that makes some of these children not live up to a year old?
Yes. There's the health challenge, the issue of, let's say, the environment, when to get vaccinated. There's just a lot of other factors, and we also come in that way in terms of there's an educative part of HerBabyBox, which is called Out of the Box. So aside the items that come out of the box, there are also other factors that could help these mothers. And we prompt them on when to get vaccinations to also help the baby. We prompt them on how to save, financial literacy to be able to help save for your child. So, when you don't have these things, aside if we give you all the items and at the end of the day, you still cannot provide for your baby might end up, you still do not vaccinate your baby might end up not making it. So, yeah.
Right. Aside NGOs like yours, do you think that there are government organizations dedicated to making sure that these children live a healthy life?
None that I can, because yes, I think so. I think so. I think so. There are lots of NGOs out there that do, if not similar, but I think take up stuffs that we do. Yes, I think so.
Right. And are there certain follow-ups that you do for these nursing mothers that you gift the boxes?
Yes, of course. If you check on our Instagram page, we have, as I said, the follow-up program, which is like out of the box. Aside educating them, we call them. So when we visit them, we take their contacts. If they don't have contacts, most of them do not even have phones. We take their address. So once in a while, we visit them, take out time to call them, find out what their challenges, find out what they want. And we also have doctors on the team. So if there's if there's a problem, we're currently building an app that will prompt them or that will give them all those things for no cost. But right now, because we're not done with the app, we do the follow-up, call to call. We call to check up, call to find out. You speak to doctors. If your child is having this or that, you speak to a doctor on the team.
Right.
Yeah.
And working with a ballpark estimate now, how well would you say that giving children the basic necessities that they need to be taken care of and giving the mothers the conducive environment as well will help these children live a long and healthy life?
Can I take that again? I didn't hear.
So I was just basically asking, like, to what extent would you say that, like, these things your NGO does and with the help of the government, how would you say that if these children have the necessities that they need and a good, thriving environment, how well would you say that it will help them live a longer life as opposed to the level of child mortality that we're experiencing now?
I think the answer is in Finland. For Finland, if you check the comparison, less than two deaths per 1,000. Why? Because the government puts in things like this. So if you give birth, if you're pregnant, you give birth, you're a nursing mother, whether you can or you cannot, the government provides these items for you. That's why they are regarded as the world's happiest people. So if it's working there, these amenities are there in terms of the educative part for mothers, educating them when and how, getting doctors like at their ASAP when they need maybe a number to call and everything, providing them with these basic amenities, immunization, everything as a whole, I believe that is going to reduce the rate of infant mortality drastically.
Okay, but looking at the economy that we have, the economy of Nigeria, looking at how staggering it is, especially in 2023, do you think that it's possible to adopt these measures that Finland uses?
Yes, it is. I believe so, because if we as a country, if we as a nation, we intend to, or we always say that we look out for our own, and we always say that the bedrock of a society is how we raise the kids. Say, train up a child the way he should go, so when he goes, he will not depart from it. That process of training up a child, if these children are not alive, do you understand? There's no country or there's no one to look up to. There's no one that would later grow to become an ancestor or a forefather. So we need to pay special attention to these children, people who would raise policies tomorrow that will take the country to the next level. So I believe that is something that can be done. Because if you do not even, I think you have to count one before you count two, which is if these kids do not make it, we can't even talk of educational policies, because who are you making the policies for? Who are you trying to send to school when they are all dying at a very tender age?
Well, would we now say that it's an issue of priority, because a lot of times, for example, in the education sector, we've heard so many teachers and, organizations say things like the government does not prioritize the education sector enough. It's not like they can't afford to cater to that sector, but the priorities are just, not right. So do you think that same thing applies to child health in Nigeria?
I think so. I think so. I think health is key. If you're healthy, even as healthy babies who can agree that, sorry, excuse me, healthy babies would later turn to be great people in the society. I don't know what the statistics is, but I believe that people who are healthy gives them clarity to think, there's just a lot that could be done. And I think it's a thing of priority. If being prioritized, would definitely make progress in reducing the rate of infant mortality.
All right, let's talk about something that is not very common, but it's not also impossible in this economy. Now, there are instances where we've heard of, some people donating to new mothers, nursing mothers to take care of their children. But because of the economy, some of these mothers sell part of the things donated to them so that they can at least find something to eat for themselves or cater for themselves or afford, their house rent or something. And at the end of the day, they're trying to prioritize their health or their living conditions. And then they, let's say, shorting the ration of these babies, which is not their fault. Has your organization experienced anything like that?
Yes, and that's why we educate them. Like, we talk to them genuinely, we try to explain to them what it is and why they should put their babies or their kids first, right? I believe that children are a blessing to this world, and some families, when a child is born into a family, you do not know. Maybe that child might even be the person that takes the family out of poverty or whatever be the case. Most of us have and can relate to such stories. We came from nothing and we're doing something. Our family is okay by virtue of what we've done. So try as much as possible to educate them properly, tell them how to save. We also refer them to also NGOs that do some like skill acquisitions and all of those things to help them be also able to take care of these babies. And most times when we go to the hospitals, we find mothers who are not able to afford or pay for their hospital bills. Even if it's not part of our mission, we also write off, depending on how that day goes. We pay for their bills.
Right. Impressive. Also, I think this is going to be my final question, but what are your hopes for child health in this country in the next 5 years?
I hope that every child is able to access basic amenities, like whether to take care of them, like to. I hope that this country is able to provide for these children, to cater for them, because they are the future of tomorrow. I just hope that we get to a stage where, at least in a state, we have more than 20, 50 hospitals looking out for children, whether they're in rural communities, just giving every child an equal start, regardless of background, tribe, race, ethnicity.
Right. I mean, I think I would join my hopes with yours in saying that. And hopefully, just like Finland, we will be able to reduce child mortality to the barest minimum. But just like you said, it takes work, especially on the part of the government. I mean, on your own part and on the part of so many other organizations who are trying, maybe not reaching out to nursing mothers, but at least trying to reduce child mortality in their own way. In addition to that, the government also needs to take action, to ensure that child mortality is reduced as well. But once again, thank you so much, Victor Obisike-Amadi, co-founder HerBabyBox Africa. It's really impressive what you do, and more grace to your elbow. Thank you so much for joining us.
Thank you very much.
A pleasure, and compliments of a season to you.
Same to you.
Well, this is where we call it a wrap on Village Square Africa. This is our Boxing Day special, and I would say compliments of a season to you and yours. Do stay with us. The news comes up next, and join us in our subsequent episodes as we discuss this critical issues, and not just discussing it, but also trying to find solutions to some of these issues that bedevil the society and the African continent at large. My name is Blessings Mosulu. It's been VSA.